Those are things we want to really empower the patient to take better care of themselves, but also make all that data available easily to all the care providers within that patient's circle of care so that everyone has more information to ultimately make better decisions on behalf for that patient.
Not everyone makes the news, but behind every growth-driving experience, product, and transformation are experts who shape the outcome. Welcome to Behind the Growth, a podcast for digital leaders and those aspiring to become one. Each episode features a candid conversation with a remarkable individual. Join us as we focus on their struggles, wins, and lessons learned you won't find anywhere else. Let's get started.
Hello and welcome to Behind the Growth, where we delve into the innovations and strategies propelling today's businesses forward. I'm your host, Imran Mian, and in this episode, we are exploring the transformative world of digital health. We are thrilled to have Aaron Cheng with us today, a distinguished leader in digital health, currently making waves as the Vice President of Digital Health. Aaron's work is pivotal in integrating technology with healthcare to not only enhance patient care, but also streamline healthcare delivery. Today, we'll discuss the vital role of digital health in pharmacy healthcare strategies, drawing on examples like Shoppers Drug Mart's innovative approaches, including their PC Health app, to understand how digital solutions are making a significant impact on Canadian healthcare. So join us as we uncover the future of healthcare through the lens of digital innovation. Aaron, welcome to the show. Let's start with your journey. Maybe you could spend a couple minutes and take us through, what led you to be in your current role as VP of Digital Health, and talk a little bit about your vision for digital health in the healthcare industry.
Yeah, definitely. So thanks. First of all, super happy to be here and have this conversation. So I'll say my career I never actually thought I'll end up in kind of the healthcare industry when I started my career. Like, as maybe any Asian kid, like originally my parents wanted me to be a doctor. I was always vehemently against that. So I actually went on the other kind of typical path where I had engineering by background, but I've always been in kind of digital products, starting in Microsoft in Seattle for a couple of years, working in their mobile division, and then eventually moving back to Toronto, working in various kind of...
that was the right decision. You moved back to Toronto. Generally, people go from here to Seattle, but you moved back.
For sure.
You made the right decision, my friend.
I'm just more of an East Coast guy, I guess. So so definitely moved back to Toronto, worked for some software companies, one of which got bought by IBM, and I was there for about 3 years, building a cloud business there. And that was pretty much the first decade or so of my career. And near the end of my IBM tenure, I kind of realized that I kind of got as good as got at IBM in terms of being able to work on some really cool new technologies and starting a new cloud business. But I was still spending maybe half my time dealing internally with how budgets gets allocated and how do we work with different departments, rather than thinking through of how do we better serve our customers, how do we build a better business, build a better product. And that's when I decided to kind of make a switch and went into startup space. So this was in 2015. I started by moving to a startup called Flip in the West End of Toronto. They worked on digital flyers and grocery circulars. And that was an amazing ride for me, 3.5 years there. We went from about 100 people when I started to about 450 people. Really loved every minute of it. There's definitely highs and lows and up and downs through that process, but learned a ton. Loved the environment, fast pace, and great decision making there. And really did a lot in terms of turning Flip into a household name across North America and really become the number one player in that space. After that, I went to another startup called Coho, which is at the time was a digital banking kind of neobank startup. Kind of a similar story. I was there for about 2.5 years. We went from about 40 people when I started to about 250 or so when I left. And COVID was during the middle of that. And that's when you start to realize, you don't need a branch to be successful as a bank, and really as a chance to disrupt the Canadian banking space and make a big difference to a lot of Canadians who were really suffering from lack of access to banking, to financial services, and create a great offering there. But I think during COVID, as a lot of Canadians, you start to think a lot more about the fragility of our healthcare system and what can be done there. In many ways, healthcare remind me a lot of the banking industry in terms of being super highly regulated industry. It's something that, if you're non-Canadian, you feel like, hey, Canadians, your banks are strong. Hey, Canadians, you have free healthcare. What more do you want? But we who live in the country, we actually know that there's plenty of room for improvement. And there's lots of areas that can be a lot better. And healthcare was definitely something that you realize. And that's when I started looking more for what else is there for me. And I joined, at the time, it was a fairly small startup called Felix Health at the time. But what was different about Felix at the time from the traditional, maybe the telehealth startups that sprung a lot during COVID was they tried to combine both a virtual care provider together with a digital pharmacy. And it was really an end-to-end model where it was really about providing end care to the patient and really doing something different that was uniquely digital was something that couldn't have been done in the physical world. So that really attracted me there. Learned tons about healthcare industry. I would say, even though I've previously always moved into new industries, my previous roles, healthcare was by far the biggest ramp up of learning the ins and outs of the healthcare industry, but learned a lot about actually the physical aspect of it as well. What does it take to actually build a pharmacy, to actually prepare all the medications, get it delivered? And it was a great experience, 1.5 years. And honestly, at the time, I was planning to stay within the startup space for the rest of my career. And that's when Shoppers reached out around summer of 2022. I was always intrigued by Shoppers in terms of just by size, right? And as a startup at the time, we always feel like if we build a product, it works really well, and someday we can impact millions of consumers. Whereas at Shoppers, the access is right there. We're already impacting millions of consumers, and we can make a meaningful difference in the Canadian healthcare landscape. And really talking to the president of Shoppers at the time, it really inspired me in terms of Shoppers' vision and making digital healthcare a core of that. And they don't see it as, even though Shoppers has a super strong store network, I think there's stats that about 95% of Canadians live within the 5 to 10 kilometer radius of a Shoppers Drug Mart. So there's a huge convenient access, but they really saw digital as a core part that they need to invest in to really complement their physical in-store network. And they really saw that as a key of delivering better care for our patients. So that really aligned with my goal and what I wanted to do. And so I joined in late summer of 2022, been here about a year and a half. It's been a great ride. We've done a lot of things of really building out the digital solution, starting as PC Health as what we see as that digital front door for Canadians, but really critically thinking of the gaps in the current Canadian healthcare landscape. How do we provide better access to millions of Canadians? And I think everyone's heard the stats of anywhere from 15 to 20% of Canadians doesn't have access to a primary care physician. And we know as the Canadian population growth and as primary care providers continue to into retirement age and age out, that will just become worse. And given that the primary care providers read the entry for Canadians to get any kind of care and access, that's a critical point in our kind of journey to provide that care to Canadians. And we think pharmacy can play a big step in that. And I'm happy to be part of this kind of overall journey to provide that better access and better care for Canadians.
That's phenomenal. I'm absolutely intrigued by your experience in the startup world and then moving to a big company like Loblaw and Shoppers. We'll save that conversation for another day. I'm very, very interested in talking about your experience in both worlds. But it's a good segue into my next question. Reflecting on the role of pharmacies in healthcare, how do you see digital health enhancing the traditional pharmacy model, especially in the context of patient engagement and care, for example?
Yeah, I think it's really a shift in how we think about pharmacy and how we think about care in general. Like I mentioned previously that the Canadian healthcare system is really predicated on the primary care provider as entry for anything, right? Like I think before, I believe 1970, there wasn't even a walk-in clinic anywhere in Canada. That model only started around 1970. So previous to that, any type of care, other than an emergency room, you have to go to a primary care doctor to either get treatment, get a prescription, or get referred to a specialist. Now, as walk-in clinic, as that become more prevalent, there's another avenue there, but we know it's not enough, nor is it the most economic model for it. Like if you think about any other industry, you usually try to pair the problem you're trying to solve with the best solution to fit for it. And given the gamut of different conditions that any kind of Canadian, any patient can go through, it doesn't make sense for a doctor to be the first line to triage all of those conditions when they are our most experienced, most highly educated, and frankly, the most costly solution to our healthcare system. So whereas we have a lot more pharmacists out there, obviously with Shoppers Drug Mart was our retail footprint, there's a lot more access to it. And having that being a first line of defense and then working together with family doctors, with specialists to provide a better care and creating really a holistic healthcare system there. And I think where the digital plays that role is really to complement that physical aspect. I think there was a period maybe during COVID where people thought everything would be virtual and everything would be digital. Obviously, that's not the case anymore. But at the same time, digital also isn't a fad that's going to go away anytime soon. And it really needs to kind of be married and work together. The analogy I always use is when you get a personal trainer to help you get in shape, right? You go to a personal trainer, you see them maybe once a week, twice a week, they'll prescribe something. It's great. That's a great experience. But at the same time, to complement that, you may have your MyFitness app that teaches routines, that complements that kind of digital trainer. And when the trainer is not there, they can keep you accountable and stick to your routine. And together, that's going to both the digital app experience with the physical trainer. They're meant to work together to help you get in better shape and achieve your health goals. And I see the very much same thing of how kind of in-store pharmacist visit will work with the digital app experience, where they complement each other together to deliver the best health outcomes for our patients.
Absolutely. I think that's a great analogy. Let's talk a little bit about your approach at Shoppers. Shoppers been a pioneer in integrating digital health solutions, such as the PC Health app, as you rightly mentioned, into the overall services in pharmacy that you guys provide. So in your view, what makes this approach effective?
Yeah. And I think one of the good things is, even though Shoppers is a large corporation, we're very much taking a test and learn approach with this. And one of the tricky things in this space is I don't think there's any model there where we can point to say they figured it out and just copy that and it'll work out. First of all, healthcare is very different in many different countries. And arguably digital adoption itself has been slower than many other industries. Like if you compare to my previous industry in digital banking, that's something over the past 10 years now. Like digital banking account is nothing new. It's just people expect it. Once you open a bank account, you get digital access. People have the app. That's just part of the fabric of it. If you look on the healthcare side, there is just way more paper involved in it. Believe it or not, a lot of our pharmacies still use fax to get a lot of prescriptions, and that's a way for pharmacists to communicate with doctors. They send faxes back to each other. And that's still a pretty common thing, despite a lot of digitization efforts. So there is a bigger opportunity there for us to grow, but there isn't a set model where we can just point to it and it works. So Shopper has very much taken an experimental approach where we've tried many different things on the digital side, different versions of the app, different versions of the value proposition to users, different website properties. And I think over the past couple of years, we finally landed on this PC Health model that's really meant to complement the physical. It's not meant as a separate application that, you can do some exercise and doing all of that, but it's really meant to work together where we have evidence-based programs that can really complement the physical journey, providing a single health record, and also integrating in a lot of our enterprise assets like PC Optimal Points. So we really want to reward our patients as they get healthier, as they do the program. We want to reward them with points as well, so that there's an extra motivation for them to stay on top of it. So I think it's really that combination together that works for delivering the best consumer experience and help them achieve outcomes, along with the mindset that we're willing to experiment, we're willing to try things out. There's no kind of illusions that we have figured everything out, but we're willing to try and tweak and work with different experiments, work with different providers to figure out the best model as all of us are kind of going through a transformation process.
I think the two industries that I believe have the most engagement with their either patients or customers is the financial industry, like the banking, because everybody wants to check their, balance, the bill payments, et cetera, et cetera. And the other one is healthcare, because it's more important than your finances, right? So
Sure.
as much as every industry is going digital, but I feel like these two are the ones that have the most amount of sort of active, engaged users, right?
For sure. And I'll say just anecdotally, I was at my optometrist recently, and she was asking, what medication I was taking. And, I put on my app and PC Health is on my prescription. I can tell her exactly what medication I'm taking or what I've taken in the past. But if you think about typically, in a lot of cases, when you ask people what medication, they bring their bottles, right? They bring their old bottles and say, hey, I'm taking these things. If you think about where we are in the 21st century, that's really things, there's a lot more room for digital adoption just to make kind of day-to-day life a lot easier in terms of quality of life improvements to every person's life.
Yeah. So let's talk a little bit about, I know we've been talking about digital, but in 2022, I guess around November, December, everybody sort of heard AI, right? So over the last 12 months, AI is really like, it's been hyped, and there's some practical use cases. And I believe healthcare is the most practical sort of a use case vertical for AI applications as we speak today. So in your view, the role of AI in digital health, and also like the AI applications, what sort of potential do you see and the impact on patient care when you combine AI and digital?
No, that's a really good question. And I think obviously as any industry, like everyone's kind of keenly aware of what Gen AI and what that's possible. Though I would say in healthcare, there's an especially high bar in terms of the quality and what AI needs to do before we roll out, especially from a consumer perspective. If you think about it, you ask your ChatGPT answers, if they hallucinate on a travel question, you don't like it, but it's not the end of the world. On healthcare, there's a much higher bar in terms of the question we're able to deliver to patients and the need for that to absolutely 100% being correct. And obviously, there's even a heightened sense of in terms of how we even train our models in terms of our data privacy, data security, and there's just a heightened standards that we take through. And obviously, we as Shoppers and Loblaws, we have very strict standards on what we do with any patient data and what we can and can't do with that. So there's a lot of barriers in terms of rolling out maybe the ideal utopia solution of you can just ask a bot of exactly, feed it the health data and it'll tell you exactly what's wrong with you. I do think we're quite a ways from being able to do that. But what it can help I would say it's more on the back end side in terms of within the healthcare system. I mentioned the point about there's still a lot of faxing going on, but in addition to that, there's a lot of paper in our current kind of healthcare system. There's a lot of manual administration work that's kind of still go through in the healthcare system. And that's where I think actually AI can help a lot of it to kind of automate a lot of those things and burden a lot of those kind of tasks. So that's a lot more efficient so that when they're providing care or a pharmacist providing care, they're spending most of the time with the patient themselves rather than worrying about doing the back-end administrative tasks, right? And I think everyone has stories and tasks where for every hour of doctors or pharmacists that they're actually providing care, they're spending way more amount of time doing the back-end admin work that's required right now for our healthcare system. If we can automate and eliminate just a fraction of that, that would just give each doctor and care provider and pharmacist just a lot more time to be able to work with patient. And that's ultimately what they want, right? Patients want that individual attention. They can talk through. They don't feel hurried. If they have two issues they want to talk through, it's not booking at the next appointment to talk about the second issue. It's about they have a holistic view of their patient record. So that's really where I think a lot of AI can provide a lot of initial value of it to create that efficiency. And then over time, obviously, there will be a lot more patient facing, but I do think there's a very high bar in terms of quality it is and to build that trust in terms of what AI can deliver before that's ready for full consumer consumption.
I agree. Let's talk a little bit about the rapid adoption and evolution of digital health technologies and some of the challenges around it. So in terms of the challenges, how do pharmacies cope with what are some of the challenges, for example, and how do you overcome these challenges, hurdles?
No, and I think, look, if you look back on COVID, I think everyone at least living in Canada got through, like there was a round when initially the vaccines were out and everyone wanted to get a vaccine. And I think everyone went through some frustration of where's the openings? How do I book the next vaccine appointment, right? And there's government systems, there's individual kind of company systems. And it was a huge transformations that created a lot of stress for our pharmacies as well. Obviously, as first-line care providers, the pharmacies want to serve their patients and want to provide better care for their patients. But there were one of the few retail locations that was open. There was a lot of chaos in terms of huge demand. I think huge phone systems got jammed up and a lot of that. And that forced Shoppers Drug Mart, included the whole industry, to rethink, like, what are the 21st century digital experience we need to enable, right? Starting with, you should be able to book your appointments pretty easily now. And if you started looking at last year when we call it, like during the fall when we had COVID spike, when we had the flu season, when we had things like RSV, if you compare to what happened a few years ago, where a lot of it was just people walking into pharmacies, walking to doctor offices to get their shots. Now, up to 60-70% of our patients actually just book appointment online. It's a lot more organized. We can plan better ahead for both, how many vaccine supplies we need in our pharmacies, how many pharmacists we need to be in the office to really plan ahead. So that's maybe just a small example of how much the industry has changed in just even the last couple of years, where it's a given now that you book appointments at pharmacy to get a service system. So that's maybe just a small example of that. As the scope of pharmacists further expands into, in Ontario, for example, just over a year ago in January 1st of 2023, they started by offering 14 minor ailments where for the first time now you can actually get prescriptions for certain things like a UTI, pink eyes, and things like that, where rather than maybe wait a few hours in line for a walk-in clinic or, book appointment with your family care provider, that's for a week later, you can just go into a pharmacy on the same day, talk to a pharmacist, get the right care you need, get a prescription, and then fill it right on the spot. So those are kind of experiences that we're managed to enable. And that's really been a wholesale change. And obviously shoppers, we've made a lot of investments in that where I'll say maybe 10 years ago, if you go to a pharmacy, like there may be consultation rooms, but a lot of time it's a curtain that kind of closes on. We made investments to remodel a lot of our pharmacies across the country where we actually built real consultation rooms with the right equipment, with the right expertise there to really provide that environment for our patients so that we are there to care for that patient and not just to fill a prescription. So those are some things from both kind of the digital of scheduling things like that to the changing the physical space that we've been working at Shoppers to really move towards the next step of providing better health access to Canadians.
Yeah, that's phenomenal. Talking about next steps, looking ahead, how do you envision the future of digital health in the pharmacy sector? And what trends should pharmacies be prepared for or preparing for now?
Yeah, I think a lot of it is the way we see it is healthcare from a digital perspective should be just as easy as any other industry. If you remember, maybe again, using banking analogy, maybe 5, 10 years ago, your banking was a bank, you have checking once done. If you apply for a mortgage, there's another form to fill out where they're literally asking your name, your address again. And everyone probably wondered, you're my bank, you should know this. Why am I filling out the same form over and over again? And the banking industry, to its credit, have got away with a lot of that. If you're their bank customer, they already know a lot about you. You know, there's a lot less redundant paperwork, but that still exists a lot in healthcare, right? And just again, speaking from personal experience, a couple of weeks ago, I had an MRI. I had to go in for MRI. Obviously, my doctor referred me to the hospital. I went in, checked in the hospital. First thing I did, fill out a form to say my name, date of birth, address. Checked in. Next step, go to the second floor to an MRI section. And again, the first thing, I get another form again, name, address, date of birth, whole bunch of questions again. And that's just a pretty standard process if you go through digital, where you're just also wondering, like, why shouldn't my doctors already know about me, right? And if you go to right now, if you get referred to a specialist, they'll probably go ask you the same amount of questions again, asking about your family history and all those things. And that information, it just isn't flowy. So you may think of it's a nuance. It's not convenient for you to provide the same information again, but actually also hurts a lot the level of care patient provides because the doctors, in those cases, they have just less context about the patient, your healthcare record, your health journey. And what we hope to do having pharmacists and what's the digital experience we want to provide is really become that single patient record. So whether it's your medication history, your vaccine record, or service you've seen, all that information should be readily available to any care provider you go to, assuming obviously the patient controls that and provides the right permissions. But also the patient should be able to see that, hey, how is my blood pressure been trending over the past year? How's my A1C or blood glucose levels? And is there any correlation between my blood glucose and my Apple Watch? And is there a correlation between if I walk more steps, do I have better blood pressure? Although things like that and insights we can expose to the patient. Those are things we want to really empower the patient to take better care of themselves, but also make all that data available easily to all the care providers within that patient's circle of care so that everyone has more information to ultimately make better decisions on behalf for that patient. So that's really kind of a sliver of the vision we hope to achieve, to having that single patient record where everything is easy and there's no less information silos, and ultimately always the goal of how do we provide better care for that patient and help them achieve better outcomes.
Well, that's great. Thanks for sharing that. We're coming up on our time. Before I wrap things up, I wanted to ask you one last question for the young women and men out there who are interested in pursuing a career in digital healthcare. Mm-hmm. What advice would you give them?
Yeah, I think obviously I'm biased, but I feel like it's a great area to get into. I think what I've realized over my career is you can work in industry, you can solve innovative problems on it, and you can make some customers pretty happy on it. But as I transition through, if you look at my previous 3 industries, I was in e-commerce and it was how about saving money, which is great, a great thing to do. Next was about financial services and giving people better access to financial care. That's even better, like in terms of getting stories and things we can do for our patients. But now we're really helping Canadians to improve their healthcare outcomes. And it's one of those things where last week I spent maybe a few days just visiting our stores a little bit. And sometimes I think, day to day, it may feel like a slog of dealing with issues and dealing with fires, but really going to our pharmacies, seeing firsthand how much digital tools have been used by our pharmacies to help the pharmacist's job easier, but also really help our patients live better lives. And that's just a super rewarding thing. So I'll say from maybe a self-actualization perspective, I feel it's a great place. Ultimately, we're making a huge difference to Canadian lives. And in terms of getting to the industry, there is, I'll say, a ramp up to the healthcare industry because it is a very complicated, but it's something that anyone can get into. There's very many different avenues of getting digital healthcare. In terms of my team, I have people who are digital native, who comes from more of a digital product background. I have people who come from a consulting and healthcare background. I even have a nurse on my team who started as a nurse, got interested in digital, and then transitioned to a team. So I would say it doesn't really matter your background. You can move it as long as there's that hunger to learn and really an interest, right? It is a complicated industry, so there has to be that native interest and curiosity there to learn the industry and ultimately wanting to help patients to get better care.
Amazing. Well, Aaron, it's been an absolute pleasure having you on Behind the Growth. Your insights into digital health and its integration into pharmacy healthcare strategies offer a compelling glimpse into the future of healthcare. Your leadership and vision in this field are truly inspiring, highlighting the potential of digital innovations to revolutionize patient care and healthcare delivery. To our listeners, thank you for joining us today. We hope this conversation with Aaron Cheng has illuminated the exciting possibilities that digital health presents for improving healthcare outcomes and patient experiences. Stay tuned for more episodes that explore the forefront of business growth and innovation. Until next time, stay curious, keep looking forward to the future and embracing the change that drives us forward. Take care. Bye for now.
Sounds good. Glad to be on the show.
Thanks for listening to Behind the Growth. If you enjoyed this episode, make sure to follow along on Apple, Spotify, or your favorite podcast app. This podcast is brought to you by Mobile Live, a team of digital experts bringing intelligence and efficiency to how businesses sell, serve, and save. For more episodes of Behind the Growth, please visit mobilelive.ca/podcast.